This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting-edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. Dr. Ben Weitz here. For those of you who enjoy listening to the Rational Wellness Podcast, please go to iTunes and give us a ratings and review. That way more people will find out about the Rational Wellness Podcast. And please subscribe either on iTunes or YouTube or wherever you get podcasts. So our topic for today is oral health. And I'm happy we have dentist Dr. Ryan Nolan with us today. Like in the gut, there are healthy bacteria in the mouth that are beneficial for us. We can refer to this as the oral microbiome or microbiota. And it's estimated that there are 500 to 700 different species of bacteria, that's right, in your mouth that can exist there. And there's even an online human oral microbiome database. Many of these bacteria are helpful, known as commensal. Sometimes we get an overgrowth of some bacteria that throws the oral microbiome out of balance. We can also get pathogenic bacteria or viruses or fungi that can grow there and cause problems. Microorganisms in the oral cavity have been known to cause tooth decay, periodontitis or gum disease, and various other oral infections. It's also known that most of these oral infections are caused by a group of organisms organized in a biofilm rather than by a single pathogen. This biofilm on the teeth is generally referred to as dental plaque, I believe. There's also increasing evidence linking bacteria in the mouth to cardiovascular disease, diabetes, pneumonia, preterm birth, and other conditions. Dr. Ryan Nolan is a dentist and researcher located in Orem, Utah, and he's been focused on the role of biofilms in the oral cavity. And he's developed a type of specialized mouth rinse product to target these biofilms and raise the pH and improve the health of the teeth and the mouth. He's published a scientific paper focused on this product entitled Anti-Caries Potential of Silver Nanoparticles via Modulation of Free Calcium Activity within the Plaque Fluid of the Oral Biofilm, a pilot study. Dr. Nolan also has a podcast, The Biofilm Factor. Dr. Nolan, thank you so much for joining me today.
Oh, hey, thanks again for having me. Appreciate it.
Before we get to the tough question, or before we get to the scientific questions, I got to ask you, is your dad a baseball fan? Because every time I write your name, I go, Nolan Ryan. No, Ryan Nolan. Nolan Ryan. No, Ryan Nolan.
So it's funny. So we're Canadian originally. So I'm American naturalized.
Okay.
So I'm a U.S. citizen. But so we're all from Canada. Mom and dad didn't know the famous baseball pitcher, right?
Okay.
But from a strange turn of events, we ended up living in Dallas, Texas for like 6 years.
Really?
So yeah. So when I lived there, everyone called me Nolan, like it was my first name. So I got used to that. Then I moved back to Chicago and people would say Ryan. I go, who's that? Like, that's not me. I'm Nolan, right? So yeah, it ended up affecting my life a little bit more probably than you think. But yeah, no, he's great. I still watch some of the older stuff that everyone follows. But I have no baseball skills, unfortunately. Can't help you there. But no, he didn't even know. My parents were like clueless as to this famous pitcher. But yeah.
Okay, so in functional medicine, which our podcast is really focused on, we often focus on the health of the gut as one of the keys to our overall health. And the oral cavity is really the first portion of our gastrointestinal tract. Yep. So can you talk about the importance of the oral cavity for our overall health?
Absolutely. So, if you consider the body a bunch of windows, right? I would say that basically the first window that really reflects what's going on in the body is your mouth. But the reason why that is because the second window, which is your gut, is actually the most important part of your entire body. The reason why is it's because the distribution center. It's where all the energy goes. It's where everything gets distributed and compiled. And it's also where a lot of bacterial interactions with the body also occur. So naturally speaking, the gut is really going to determine how healthy you are. If you don't have a functioning gut, if the lining is leaking, if for some reason there's a bacterial overgrowth or other kind of bacteria that are releasing toxins, those are going to get into your system. So it's essentially like, how would I put this? The mouth is probably like the moat, and like if the castle door is open, that would be the gut, right? So you don't want to let them get past the moat. That would be kind of my thinking about it, right? And
Okay.
we see this a lot with patients that come in, they have a horrible mouth, and I can almost to the T now look at someone's mouth and be like, okay, this person probably has a good chance of heart disease, probably has diabetes, probably has this. And believe it or not, 9 out of 10 times I'm usually right, and it's sad. It's
Yeah.
really sad. But basically, we look at the mouth as more of a gateway into the gut. And since the gut is such an important feature of how our health functions, especially our immune system, it just ends up being a pretty damning representation of how things are going.
Yeah, no, I know, I totally agree with everything you say. And in fact, I was just talking to Dr. Vashtani, who's going to speak at our functional medicine meeting tonight, and
Nice.
there's a connection between periodontal disease and Alzheimer's disease because of the
Yes.
gut-brain connection, etc.
Yep. So basically, if you look at it, right, people who have periodontal disease, I always say this, and I don't think I'm alone now in saying that periodontal disease is like the diabetes of the mouth. The reason why is periodontal disease affects every organ system in your whole body. It is not an isolated issue to the mouth. These organisms are able to basically get through these junctional epithelium. If you notice, anyone who's got periodontal disease, they have bone loss. But on top of that, they have constantly inflamed gums. And so basically these organisms can easily get into the bloodstream at that point because there's no junction to like basically prevent that. Typically, a lot of the organisms that cause these diseases are motile, meaning that they have very good ability to move around. And one of the organisms in particular is called a spirochete. It kind of looks like a corkscrew. These things have been directly not correlated, but actually proven to cause coronary artery disease, right? So we know that they can increase your risk for a heart attack, among other things. And it's nuts because when you really start thinking about it, that's just one of the issues. People who have
By the
periodontal
way,
disease.
for
Go ahead.
people who aren't familiar with spirochetes, these are a particular type of bacteria, and Borrelia burgdorferi, which is the cause of Lyme disease, is a very prominent spirochete.
Absolutely. And I was just going to say too, there's been recent studies coming out linking periodontal disease to, it's already linked to diabetes, as you know, but it's also linked to Alzheimer's. And if I remember correctly, the one study said that if you have periodontal disease, you're 5 times more likely to get Alzheimer's, which is nuts. Okay,
Right.
so some stuff going on in your mouth you would think would be isolatory is actually affecting your entire body, and not just your brain or your heart or any of these other things. Uh, I think the other thing we should mention too, just real quick, is a lot of research has been done as to how the gut functions. And one of the things that when periodontal bacteria, they get into a home where they're really not supposed to be in. So they're in a foreign home, right? But they end up having this mechanism whereby they can start controlling how certain gut functions. So like they can actually, every time you eat, the gut actually tissue opens up to accept the nutrients, right? To go in your bloodstream. So they can find ways of getting not just through the bloodstream, through your mouth, but also once they're in the gut, it's like they have a free highway ride to wherever organ they want to be in. and that's really scary, right? Because we know that if they're in a home they're not supposed to be in, they're going to cause more damage.
Yeah, I understand. Once in the mouth, there's actually a route directly to the brain through
Yes. Yeah.
through
So
where some of the nerves pass through, right?
yeah, so it's more prevalent actually on your front eye teeth, so your canines, right?
Yeah.
So there's been people who have died because they got an abscess or an infection in closer to that area, because there is actually a connection to the brain um, through the bloodway path going forward. I don't remember all the anatomy. I just know that there's been a lot of cases where people who have gotten abscesses in that region are hospitalized and die, and
Right.
that's really scary.
Yeah. I know some functional medicine practitioners who, in a hacking sort of way, will sometimes use certain nutrients in the mouth in a certain liposomal form because they'll be taken into the brain and actually help improve brain function also. So,
Well, you say that, it's funny because we know like that the mouth is the most vascular area of your whole body, right? So basically, if you have a small infection in your mouth, now it might only look small, but that would be like the equivalent of being your whole forearm covered in like essentially like being completely infected, right? In terms of surface area. Because if we look at all the blood vessels, that surface area is equivalent to basically like your whole arm having an infection. And
right.
I don't know anybody who wouldn't go to the hospital if their whole arm was infected, but they don't see it that way, right? And so it ends up causing so much damage, even if you don't think it, right? I had this patient and he had waited and waited. He had an infection from one of his wisdom teeth being retained. He had waited and waited and waited, didn't realize it was an issue. So we took the thing out, and he came back a week later and goes, "Doc, I've never felt so good in my entire life. I can't believe what that was doing. I was constantly getting sick. My immune system wasn't working properly because I had this infection that I was fighting for 15 years because I didn't go to the damn dentist."
Right.
And so we know these things are happening, right?
Right.
And to deny it is just ludicrous to me. It's
So,
you know,
did you do a root canal or did you do an implant?
well, for that one, since it was a wisdom tooth, it was actually, believe it or not, semi-impacted, and so it actually required removal. So that wasn't something we had to replace because wisdom teeth are like the spare tires of the mouth.
Okay.
So we never ended up having to do that. It was just lucky that it was where it was and didn't have to lose a functional tooth.
What do you think about the whole controversy about when you do a root canal, it's really hard to get the last bits of bacteria out from the, complicated canals and that.
For sure. So as a dentist, I can tell you just clinically, you're never, ever, ever going to be able to remove every single little bit. You have to do the best that you can with the technology that we have. Luckily, things are getting better. I actually started using the tools are getting better. Let's put it that way, right? Now, nothing's perfect, just like with what you do, nothing's perfect.
Right.
But look, I would say probably about 95% of the root canals that are done to a very high standard, especially in the United States. I mean, people here are great. I can't say without a doubt that some of them are going to fail. I think however, in my personal opinion, so I have a root canal. Okay, if that gives you any idea, I cracked my tooth in half chewing ice.
So on the root canal versus implant, you come down more on the root canal side?
If there's enough tooth structure remaining,
Okay.
I lean towards root canal.
Okay.
If there's not enough tooth structure, and we don't think we're going to get at least 10 years out of it, then we do an implant, right?
Okay.
Because it just makes more sense at that point to do it. But you're completely right. Look, some of these canal systems are so complex that no matter what you do, you're never going to be able to get it. However, there is this idea of threshold levels of bacteria. So even if you miss something, even just a little bit, is it going to develop an infection? It really just depends on how much bacteria were in there or how much didn't get cleaned out. So we can still see, I've seen these cases with guys that had half done root canals, like from the 1960s
Wow.
or earlier. and the tooth never had any issues. So it's hard to say, right? Because it's like, how's the immune system? How is all these,
Right.
like, so there's a bunch of factors. But generally speaking, we just do our best, and we hope that it works out. And if it doesn't, then the second option is an implant, and usually those are very high success. So
How do we assess the bacteria in the mouth?
Mhm.
Is there a reliable way to test the oral microbiota?
There's a couple of companies that are coming out with more sophisticated methods using PCR, which is DNA analysis.
Right.
So they're one of those companies, or is Oral DNA. I've used them pretty extensively, and it's pretty cool because what you can do is you can actually get an array of periodontal or decay causing bacteria or even fungus, and get an idea of exactly what's going on in that person's plaque or saliva or whatever. Because basically what we're looking at is we're looking at threshold levels. Once you start understanding disease only occurs at a threshold level, that's where pathogenesis occurs, right? So you're only going to start seeing pathogenesis if certain kinds of bacteria are all above threshold levels. And they're ranked in order of like individual pathogens in terms of their risk. And it's like you're saying though, like planktonic bacteria, which are just bacteria by themselves, and biofilms are completely different animals. And if you think, we used to think early on, so in the 30s, every bacteria is bad. Get rid of them all. You don't need them. They're horrible. And here, by the way, these are the 3 that cause disease. End of story. Close the book. Now we're kind of looking at it like, wait a second, is that true? Or is that pathogenesis more complex than that? And what I mean is, when we look at pathogenesis, it's evolved to be, okay, so there's commensal bacteria and there's pathogenic bacteria. And depending,
Commensal are good bacteria, and
yes,
pathogenic are bad bacteria.
right. So there's inherently bad bacteria and there's inherently good bacteria. I mean, some to the extent have even been studied showing that they actually release calcium in the event of a caries attack, meaning, like, let's say you had a lot of sugar and, some of these bad actors start releasing acid as a result, which we know dissolves teeth. Some of the good bacteria say, hold on a second, we're going to release some calcium to help the host because we want to survive with the host. And then there's others that want to sequester the calcium out. So there's a constant battle of titans really going on between these bacteria. What I've shifted my focus to is kind of the newest, I talked to you a little bit yesterday about this, but I've kind of shifted to the newest paradigm, and this hasn't been well adopted. So I'm still kind of on the front end of exception, I guess. But I kind of feel like it's the conditions that set whether or not an organism is going to lean towards being more commensal or being more pathogenic. It's not a pure, this is commensal and this is pathogenic all the time. And the reason is because certain organisms adapt to the conditions which you give them, meaning that there's some commensal bacteria at pH of 7 that when you put them in an environment of pH of 5, all of a sudden they have to compete with the pathogen, and they develop more pathogenic-like features in order to compete. So they start releasing acid as a response as well. And that comes from stressors and things like that. So we look at it not just from a pure, hey, genetically or originally this is commensal at correct or at normal conditions, but rather it does the condition determine whether or not it's more commensal or more pathogenic.
We've been having a great discussion, but I'd like to pause for a minute to tell you about a laboratory that I believe in and that we use their testing in our practice. Many practitioners understand that the gut is central to overall health and wellness, especially functional medicine practitioners. The medical literature indicates that an unhealthy microbiome, that's the gut in our colon, and other mucous membranes in our body, is associated with a variety of chronic illnesses, including autoimmune disorders and cognitive function, among others. That's why Diagnostic Solutions Lab developed the GI map. The GI map uses the most advanced quantitative PCR-based technology to detect microbes that can cause illness and gut problems. This DNA-based technology looks at bacteria, fungi, viruses, and parasites to see what many culture-based stool analyses simply can't find. Precise results offer a previously unseen window into our gastrointestinal health. And insights allow functional medicine practitioners to personalize our treatment plans to address the underlying causes of illness rather than merely treating symptoms. When your patients present with GI complaints, don't just guess, test with the GI map from Diagnostic Solutions. And if you're a patient, ask your practitioner to run the GI map for you. And now we'll get back to our discussion. So what are some of the most important ways to take care of the mouth and the teeth in terms of brushing, flossing? Is water picking good?
Mm-hmm, mm-hmm.
You know,
Yes.
and what is the goal? Like, do we want a certain, like we talked about biofilm a little bit.
Mm-hmm.
Maybe why don't you explain what a biofilm is?
Absolutely. So a biofilm is an array of bacteria, so individual bacteria, which come together in kind of like a Tetris stack, right? So if you ever play Tetris and you're trying to get rid of all the blocks, you're actually just rearranging the blocks in certain order. And what we're actually seeing from studies now is that there are specific orders in which certain bacteria like to attach to the tooth, and then they attach to another bacteria, and then they attach to another bacteria. And depending on what kind of stacking occurs, actually can determine pathogenesis. But you got to remember, like with threshold levels, if there's more of a bad actor around, you're going to have a worse stack, right? And so you're more likely to have a more pathogenic stack, if that makes sense. It's like if you're playing Tetris and you're getting behind and you can't seem to find the right block, everything just kind of comes together and you lose the game. It's not a fun, but basically it's a myriad of bacteria that come together and act as a functional single unit. So together they're acting and combining all their features, which is why we have such difficulty dealing with them, because now you have the bacterial resistance mechanisms from one organism, but guess what? It's being complemented by 2 or 3 other organisms now, and those organisms have the defenses that one doesn't have, and so they work together just like a community to kind of prevent things from happening that will affect them or kill them.
Now, biofilms can be helpful or harmful. Is that right?
Yeah.
Because, I mean, if the good bacteria are forming a biofilm to improve their survival, then that's a good thing, right?
Yes, absolutely. So, like I said, I think that there's definitely you can't paint them all with the same brush. However, that being said, the second you remove a biofilm, like whether that be brushing or through chemical methods, it actually reestablishes within seconds. It's not like you have to worry about eliminating everything. I mean, there's always going to be bacteria. We've evolved with bacteria. So I don't think the ultimate goal is entire elimination, right? I think the goal is to reduce threshold levels of bad bacteria, complement the good bacteria, and set up conditions whereby it mimics like what your saliva and what the natural human body, the human body wants to do, which is to just keep it enough at bay all the time. So it's more of a maintenance issue than it is an elimination issue. And that's a key distinction that we're seeing, because it used to be like, oh, you got to get rid of, you can't get rid of it. Like it's always going to be there. So you just kind of have to accept what you have and set the conditions up for the host. Right.
So therefore, products that contain antibiotics that might just wipe out a lot of healthy bacteria are not the way to go, right?
I would never, ever recommend antibiotics unless you absolutely need them.
And some of these mouth rinses have them, right?
Yeah. So this is kind of like, how would I put this, right? Let's say that you have a sniper rifle and you know exactly which person in the crowd that you need to kill to make sure that things don't go awry, right? Because we're looking out for the guy on the podium. And instead, what we do is we just basically hack and slash at every single person in the crowd. Oh, we saved the guy. It's the most archaic way of dealing with the biofilm. And not only that, antibiotics are one of the least effective ways of dealing with biofilms, because biofilms are about 1,000 times more resistant to antibiotics. So there are companies which have come out with antibiotic rinses. Gosh, way to give yourself antibiotic resistance without actually taking the antibiotics orally. What a mistake. I mean, I actually just made a post about this the other day. There's an image floating around online, and it says, I'm sure you've seen this 10-year challenge thing where everyone's showing them their pictures from 10 years ago, and they're showing them their pictures today, right? So someone got a picture of a petri dish with 3 or 4 different types of antibiotics, and showed that in 2009 there's actually a clear border where the bacteria won't grow. And then they showed a picture in 2019 and there's no border. They've literally all become resistant to all 4 different antibiotics in the span of 10 years, sitting on a dish, right? So the point is antibiotic resistance is scary. We know that these organisms, especially in a biofilm, are much better at getting, coevolutionary mechanisms like sharing DNA, sharing resistance features. So why would one of the limited things that's currently working for systemic infections and things like that, why would we expose bacteria and give them a free shot at getting resistance because of a mouth rinse when there's other solutions out there? It's just, to me, that blows my mind. That's like so archaic, like, are we trying to reinvent the wheel here, like, and putting spikes on it? Like, the point is it's just, to me, that's very, very not prudent and stupid, really, to be honest.
Right. So what you're saying essentially is, don't use some of these commercial mouthwashes that claim to kill all the bacteria because they have antibiotics in them, and they're really ultimately going to be harmful for your oral health.
Yeah. Additionally, I should say this.
Likewise, toothpaste that happens to have it as well.
Oh, yeah. You wouldn't want any antibiotics in your oral care regimen. The other thing is to say about these commercial products. One of the things that we really looked at when we were looking into commercial products is they are so acidic. And it wouldn't seem like it's an issue because a lot of these things, even though they're acidic, they do kill bacteria. But they don't do so in a fashion that really sets you up for a win after, right? So what do I mean by that? A lot of the organisms that cause disease in your mouth love acidic conditions. So so let's say you use something, and not only could it dissolve your teeth because it's acidic, let's say it does kill some bacteria and then just leaves the acid behind as it slowly dilutes away, right? Now we're setting up a condition where every organism got a free pass to an environment they love. So they're going to multiply and come back even stronger and happier. It just doesn't make sense. So I looked into this, and I really, really put like a lot of thought into it. And what I ended up finding is that part of the reason why this is because they don't have preservative mechanisms that work in the alkaline range, meaning that they literally have no choice but to use preservations and techniques and antibacterials because they only work in acidic conditions, which blew my mind a little bit, right? Because if you're thinking about it, now we're using archaic systems that only kind of work. We're giving some of the bad bacteria some advantages. We're dissolving teeth in the process. And on top of it, there's nothing that seems to be being commercially made in the alkaline range, which is where, by the way, your human saliva and stimulated is close to a pH of 8. So why the heck are we not mimicking what your body's naturally trying to do?
So the natural mouth pH is 8, you said?
So there's something called unstimulated saliva and stimulated saliva. Stimulated saliva is basically where your body starts releasing saliva. It happens throughout the day, but let's say you're chewing gum or you have something you're eating. The pH of your saliva actually goes up when that does happen. So yeah, so your saliva likes to be in probably about a pH range of 7.5 to 8. That's the ideal range for human saliva.
And I know bacteria, some like in the gut, acidophilus are acid-loving bacteria.
Correct.
Some are more alkaline. So when you're talking about a pH of above 7, you're talking about a pH that's alkaline.
Correct.
So saying bacteria in the mouth, the healthy ones generally prefer a more alkaline environment?
Yes. So commensal bacteria are 7 or above. And it's funny because even some of the bad actors stop releasing acid when they hit when the biofilm's at a pH of 7, 7.5, or 8. They don't seem to be able to function properly, and it reduces their threshold levels as a result to low enough levels that they essentially act as a pseudo-commensal, meaning they're providing competition, but they're not exerting pathogenesis. And so we've actually determined that this is the primary reason why. So if you set up the playing field in the host advantage, which is us, you're going to have a better chance of not exhibiting disease paths. The other thing I should mention too, real quick, and it's a little more advanced, but there have been studies on calcium and fluoride penetration into the plaque. Obviously, these things are helpful once they get into the plaque. The question is, do they actually get there? And the answer is no. So one of the big issues and what saliva actually does for us is it actually not only kind of breaks down the plaque, it actually releases calcium into the plaque, but it sometimes can take up to an hour or two. So we know that's the right mechanism, right, of how things work. So there's been studies done on how much of these agents can actually get into the actual plaque where the interface between the tooth is, where all this demineralization and acid buildup is occurring.
So just let me stop you for a second. So
Sure.
One of the things you're talking about is the plaque on the teeth,
Mm-hmm.
which is hopefully what you're getting rid of with brushing and flossing, and when you go to get your teeth cleaned.
Yep.
That plaque can lead to a breakdown of the calcium and demineralization of the teeth. Right?
Yes, sir. That's correct. So what we're finding is that the penetration ratio of neutralizing agents is only about 1 to 2%. That is abysmal. And not only that, at a low pH, even so at a low pH, these things enter at half the rate of a higher pH. So it's kind of like really counterintuitive now to use something that is acidic, because not only is it not going to be able to deliver what we want, but on top of it, it's going to cause all these other potential issues, right? So it's funny because the more and more I get into it, the more I realize just how bad of an idea it is, right? And hopefully that makes sense to you, but essentially it's just we want to mimic what saliva does. And in order to mimic what saliva does, we have to have something that's able to deliver neutralizing agents better than 2%. I don't know about you, but 2% that's a joke. I mean, it may as well not have even happened, right? It's not enough. So
when you're talking about a neutralizing agent, something like calcium, which is alkaline,
yes,
can help to neutralize an acidic plaque.
correct.
That it can't penetrate. And now
Correct.
you've developed a mouth rinse product that can help with that?
Yes, correct. So one of the things that we really, really looked at is we looked at all the existing agents on the market. And I pretty much couldn't find an antibacterial agent that was basically above 6. Almost exclusively about 95% of them are a pH of 5.5 or below. And pH of 5.5 is actually called the critical pH. The reason why it's called the critical pH is because that's when demineralization and decay actually occurs. So your tooth starts dissolving pretty heavily at a pH of less than 5.5. So now we have all these agents commercially available that literally can dissolve your teeth, and they're supporting an environment that's not great. So what we did is we looked at the most recent technology available. So my background's actually nanotechnology. I worked on carbon nanotubes in college, and so I actually met up with a good colleague of mine in school. His name's Matt Collister, really, really bright guy. So he knew that I worked on nanotechnology applications, and I actually was at that time actually still kind of endeavoring in that, researching that. And he goes, Brian, what if we could do something where we could use some of these nano compounds to effectively enhance the remineralization cycle? So we kind of got our heads together and started kind of hypothesizing some of these things really early on, even in dental school. And basically what we ended up doing is we spent 3 years and we actually custom engineered a nanosilver compound, among others, but a nanosilver compound that we found can actually increase the amount of neutralizing agents that get into the plaque. And we did a clinical study on it and found that when you add nanosilver, to a solution. And we're talking only about 10 parts per million. It's very dismal, like the amount that you have to use. It increased the amount of calcium that got into plaque over the control by 4.6 times. It is nuts. Like the results that we got were insane. So it basically is a perfect delivery system for getting into the biofilm. On top of that, when we engineered these, one of the major issues we had was, how do we ensure that these actually are kind of more selectively targeting the biofilm? And how do we basically make sure this stuff's alkaline, and on top of that, we want to make it non-toxic. So we actually ended up going the route of using plant compounds to synthesize these nanoparticles. And if you already know, I mean, a lot of plant compounds are very biocompatible. So basically, the outer surface of the nanoparticle is actually covered in a plant-based compound, and it actually is able to pretty selectively attach to biofilms. So now we have something that acts like a cactus spine, gets on the biofilm, gets in the biofilm, penetrates it, and opens up channels for calcium, saliva, and other things to get in. So it's kind of an ingenious system, because not only is it alkaline.
Is it the plant compound or the silver that breaks the biofilm?
So the plant compound allows it to approach the biofilm and attach to the biofilm and enter.
And what plant compound is this?
I can't actually tell you because we have our patent pending.
Okay.
But I can say it's from a plant, and it's from a pretty cool plant at that. But that information will probably be more available probably towards the end of 2019.
Okay.
But the silver nanoparticles are essentially, how would I put this, right? Silver nanoparticles are like carriers. So basically what they do is they're able to get kind of close enough and enter the biofilm, kind of rip it into pieces, if you will, put a bunch of holes in it. And silver ions are actually what ends up getting released from the nanoparticle over time. That enhances its antibacterial capacity, but also keeps things, it targets the areas which are going to be which are building up the acid, which is the deeper layers of plaque. And so that's kind of the way it works. It basically acts as a delivery system for other neutralizing agents. So instead of 2%, we're seeing maybe like 20 or 25%, which is a huge deal because, it also helps saliva do its job. So what we're doing really is we're mimicking what natural saliva is going to do in a much faster time period. So instead of saliva after, let's say you eat a bunch of sugar, right? Saliva might take an hour to neutralize that plaque acid that's already started building up. We've seen the neutralization effects within a couple of minutes. I mean, it's pretty astounding. So it pretty much works instantly. And so we're basically just mimicking what the body wants to do, and we're helping it out. So
that's great.
Yeah.
I know you mentioned fluoride also. I'm a big fan of calcium, but not such a big fan of fluoride.
Totally understand. So here's the thing, right? I mean, I'm not anti-fluoride, but I will say this. I am pro-progress. I've tested a lot of the fluoride stuff, and I just haven't seen the same level of efficacy. So when people ask me, am I anti-fluoride? I mean, you don't have fluoride in your product. Yeah, but I also didn't see, when we were doing all these tests, right? I just didn't see the same level of efficacy. And to me, I care more about what the end result is. And it just so happens that it just didn't end up in my product because of that, right? So to me, that matters more than, the politics behind fluoride. I know a lot of people aren't a big fan, but it's great because there are people like yourself who are like, look, I just want something that's going to work that doesn't have fluoride in it because I'm concerned. I'm not concerned. I use it all the time, but I can understand that. And so it's great because then you have an alternative instead of everybody else using it, and then you don't have an option, right? It kind of feels like you got shut out of the market. Is anyone looking out for me?
Right. Just to go into it for a second.
Sure.
Fluoride is a toxin in some levels, and it's given off by fertilizer industry and things like that. And the type of fluoride that's in the water, even if we decided that fluoride was a good thing, it would be nice if we agreed on that. And then we decided to put a super purified form of fluoride in, but instead we're putting this industrial waste product into the water. I forgot the exact name of it.
Fluorosilicates instead of sodium fluoride. I think that's what you're saying, right?
Is that what it is? I know it's
Yeah.
I know
It's a
it's given
green
off
looking,
by the
right?
fertilizer industry, and basically it's a way for them to dispose of this waste product. And then in the bone, it's replacing the calcium, and so just because it gets incorporated into the bone, I'm not convinced that it's a healthy thing. We'd be much better off with calcium in there.
Yeah. So here's my thoughts, right? Definitely some things that I would say, right, is that there is always a level where something's going to be a toxin no matter what. However, I think one of the things you really should focus on is how much benefit do we get from it being in the drinking water. As you know, the United States is one of the few countries that still mandates fluoride in the water. One of the things that we've looked at is basically outside of developmental, meaning like if you're a kid and you're drinking the fluoridated water, adults don't really benefit very much from drinking fluoridated water. So the reason is because the concentration is usually like 1.7 parts per million. So topically, that's not going to do anything because it's not really going to penetrate your plaque. So the only thing that's going to do is basically just accumulate in your body. It usually enters the bone, but it doesn't really offer you really much benefit past the age of 8, in my opinion, my humble opinion. So it just makes sense that, so then you have to ask yourself, okay, what's happening in other countries? What does their decay rate look like? The ones that have taken fluoride out of their system. So a study in 2015 actually compared a bunch of different countries that haven't had fluoridated water in some time. And the decay rate approaches the same decay rate that we have in the United States. So the question becomes, okay, is orally ingesting fluoride helpful? And the data doesn't look as promising as what we originally thought in the 70s and 80s. And there could be a number of reasons for that. It could be that more people are using topical agents. It could be a number of people care more about their oral health. It could be a number of different things, right? But the one issue I have with some of these studies done in the 70s is they just don't have very good controls. And anytime you look at a study, you have to have a pretty good control, and you also have to have a pretty good idea of all the variables that you should control for. So I'm not so hot necessarily on removing it from the water, but I'm able to come in with an unbiased opinion and say, but is it really helping to the extent we thought it was? And the answer is probably not, right? The other thing is I still use topical fluoride agents. Luckily, you're not ingesting them or anything like that. But I can understand why there seems to be a fair amount of people concerned about it, right? Fluoride is the most reactive element on the table, right? We know that it reacts pretty readily. And one of the things it reacts with is organic compounds. And we're an organic compound, essentially. So, look, having concerns about it is okay. And I think people need to be okay with that.
By the way, let's throw in one more thing. And I know we go on and on about this. But one of the concerns about fluoride is can replace iodine because it's a very similar compound. It's in the same row in the periodic table. And so therefore it can impair thyroid function. And that's one of many concerns I have about fluoride.
Yeah. So the other thing too, I should mention is we started seeing a lot of something called fluorosis, and I've seen it a lot in my clinical career. But basically what happens is if you have too much fluoride, you can actually develop these pit and fissures that are actually more likely to break down and get decay. I'm sure you've seen patients.
It's fairly common. Yeah.
Yeah, it's very, very common. So the question becomes, is there a point where there's too much fluoride? And I would say yes.
Especially if you're consuming fluoride in the water, right? And they've decided, okay, if you have this much water, but what if you're cooking in the water, drinking the water, then you're using a fluoride,
showering with it,
and then you're doing a fluoride mouthwash, so the compound total amount of fluoride. Yeah.
So you're exactly right. So there's many routes of exposure. I think it becomes a question of how much good versus how much evil.
And plus, if we wanted diabetics to have metformin, we want them to have a specific dosage. We wouldn't put it in their toothpaste, their mouthwash, their water, And so they're getting a completely uncontrolled dosage, and you have no idea how much you're actually getting.
Right.
So it's a very inefficient way to basically, give a chemical, a drug to the population.
Right. So I would say this, right? From a clinical perspective, I like fluoride. I like topical fluoride the most. I don't know, like I said, I'm still kind of debating whether or not having in the water makes a ton of sense. I'm going to need some more studies to have an official opinion on that. However, you're right in saying that everybody's dosages seem to be very different. And that seems to be a concern because you get people who have too much. You get people that maybe aren't getting any. And so you have a wide array of people that don't seem to be getting consistently dosed. And so that's a problem, right? And we live in the United States, which is 75% fluoridated in the water, right? And, we're comparing against these other countries that don't, seeing very similar endpoints in the decay rate. So, you know what? You wouldn't be a good scientist unless you actually questioned it, right? You got to understand why things happen. And you can't just say, oh, well, it's good, so therefore we have to have it. I think I lean in the opinion of people should have a choice. They should always have a choice.
Right.
I can't just go and
you're being given a prescription drug without your consent, essentially.
I can't go and just say, hey, look, you know what? Silver is great because it cleanses the water. Let's put it in the water. I can't go do that, okay? Even if I knew it was a beneficial compound, I just told 330 million people they don't have a choice. Right. That's not fair in my opinion. Right. So I'm with you on that. I think mandating that it's in the water, I think people should have the choice. Now, obviously, there's been a lot of push back and forth between the dental community as well as people who fluoridate the water and things like that. I just think at the end of the day, the citizens should have the choice. Really, I don't think it doesn't come to me. Like I don't get that decision. And so I'm still kind of on a fence there.
Right.
But I'm willing to question the limitations, right? I think that is okay. And if that makes me a black sheep, it makes me a black sheep. But look, if you're looking at the data is going to tell you what you really want to know. And even though we do need more studies, it's definitely raised an eyebrow for me because I'm like, well, how does that really, what kind of picture are we painting here? And the picture right now is not enough, not enough studies to confirm fluoridation in the water. Is it really working? Maybe not. I mean, so we have to question, and we have to at least pop that tomb open, right? We don't really know where that rabbit hole is going to go, but yeah. So for now, I'm okay with topical fluoride. I still have some reservations about fluoridating the water.
Great. So there's a lot more stuff we could talk about, but I think we provided some good information about oral health to our listeners. So how can everybody get a hold of you? And is your mouth rinse product commercially available now?
Yeah, so we launched it in September. We're doing a rebrand right now. So we'll have all the new bottles and a lot more new product coming out probably in February. So basically the website is elementasilver.com. And we do sell on Amazon. If you Google Amazon and then throw in Nano Silver Rinse, our product will come up. And my Instagram handle is @RyanNolanDMD. I'm very interactive on my Instagram. I try and always post thoughtful stories and things to I don't know if I'd be a pot stirrer. I don't know if that's the right word for me. I'm not Loki, but I like to question things. So if you like someone who's kind of questioning the existing paradigms, I'm probably a good person to follow because I do make a lot of posts about, hey, what do you think about this? And we do get a lot of people who say yay or nay, but they at least agree, hey, look, this guy's questioning a paradigm. He's got some evidence. Let's think about it. It's a problem, right? So we have to think about things and address them as a society, not just as a dental community. So yeah, those are my handles.
I think that's one of the keys to wisdom is always questioning our paradigms.
Absolutely. Oh, I should mention this. We do have an Instagram account for our product. It's at Elementa Oral Care.
Okay.
So you can find us there, and like you're saying, you know, we have a product that I think a lot of people are going to like, specifically because it's a different way of you know, approaching the same problem, and we do have a fluoride-free product. So if fluoride bothers you, it's not really a concern.
Great. Awesome. Thank you for joining us.
Hey, I appreciate your time. Thanks so much for having me. A
Okay.
really great discussion.
Excellent. I'll talk to you soon.